Hello, everyone, and welcome to our special guest. My name is Ray Blaylark, and I am the president of Sickle Cell Foundation of Minnesota and the mother of a 25-year-old son living with sickle cell disease. I'm thrilled to be sitting here today on the heels of Black History Month and now during Rare Disease Week to chat with a couple of folks that I'll introduce you to in a moment. But first, I want to make sure that you all understand sickle cell disease. For those who may be unaware, sickle cell is a genetic blood disorder that primarily, but not exclusively, affects people of African ancestry. It's a devastating condition that affects every aspect of quality of life, causing a variety of issues, including early death, stroke, organ failure, and pain that is well beyond debilitating. In addition to the medical complications, the sickle cell community also suffers from forms of medical bias, where all too often the racism is palpable and traumatic, particularly in emergency rooms across our state and country. Cases of sickle cell disease are growing, and the number of sickle cell medical experts currently in or seeking entry into this field is dwindling. Speaking of medical experts, though, I'm excited to be joined by primary care physician and one of our own local sickle cell disease experts, Dr. Hannah Lichtsinn. Dr. Hannah Lichtsinn, would you please introduce yourself and then introduce the illustrious Senator Klobuchar?
Well, thank you so much, Ms. Ray. It's such a pleasure to be with you here virtually today for this conversation. Like you said, I'm a internal medicine and pediatric trained primary care doctor and also a sickle cell specialist here in Minnesota. Just a little bit of background for you, Senator Klobuchar, and everybody watching. In Minnesota, like in most of the United States, people with sickle cell anemia really do struggle to find high quality healthcare. It's a rare disease, but it affects a lot of people, about 100,000 in this country. And despite that, we have nowhere near the funding or support needed to develop treatments or get those treatments to our patients. There's not enough doctors who specialize in sickle cell care, and very few healthcare systems nationally that provide comprehensive support, especially to adults living with the illness. And like you said, Ms. Ray, beyond that, when seeking care, people are frequently faced with stigma related to their illness. Because of the severe pain they experience, patients frequently need opiates for pain treatment, and we know that they're often judged or labeled as drug seekers when they're just simply seeking care and help in emergency rooms and hospitals. So the lack of investment in care infrastructure and the poor treatment of the people seeking care is tied to the deeply rooted racism in our medical system, and that only makes it harder for people who are trying to live well with sickle cell. At Hennepin Healthcare in Minneapolis, where I work, I am now building what will be Minnesota's first comprehensive sickle cell program for adults. But as you know, Ms. Ray, it's not something I can do alone because sickle cell is complex illness and our patients need a lot of support. And as a doctor, I face barriers every day in ensuring that my patients get high quality care. And so that's why I'm so grateful, Senator Klobuchar, that you're taking the time to talk to us today, because we have, so much work to do, and we're hopeful that we can do it together. So I'm going to pass the virtual mic to you so that you can say hi.
Well, very good. Well, thank you, both of you. And I just want to thank Ray, not only that she has wearing an outfit that matches her background, which is pretty impressive, but the founder and president of the Sickle Cell Foundation of Minnesota for your leadership and for bringing us together for today's conversation. And I'm really inspired. I know we didn't talk about this earlier, but your son, Trayvon's story of resilience in the face of this difficult disease. I also want to thank Dr. Lichtsinn for joining us, for all the support that you give to sickle cell patients in our state. So we're here to talk about this disease. And even though it's considered a rare disease, I'm actually head of the Senate's Rare Disease Caucus, but this is one of our least rare of rare disease because it impacts roughly 100,000 Americans. In our state, 25 to 30 newborns are diagnosed with the condition every year. And as we know, the disease disproportionately impacts the Black community. Sickle cell is characterized by heart, lung, and kidney disease. And as Ray knows too well, recurring episodes of extreme pain. These episodes can last days, weeks, even a month. They can and do lead to hospitalization. Ray's son once had an episode, I understand, that was so severe that he had to relearn how to walk. In addition to the challenges associated with the disease itself, sickle cell patients often face stigmas within our healthcare system, with medical professionals and insurers doubting the severity of their pain. That's not right. Sickle cell patients should be able to focus their energy on their health, not combating skepticism and bureaucratic red tape. I believe we can do so much to make life better for sickle cell patients. As co-chair of the Bipartisan Rare Disease Congressional Caucus, I am dedicated to making sure every person living with a rare disease has access to diagnosis and effective, affordable treatments and cures. I've supported federal funding for sickle cell research and care because the investment that we make today lays the groundwork for the treatments of tomorrow. I also lead legislation to give rare disease patients, including sickle cell patients, a better seat at the table in the drug development process because there's so much delay without actually assessing the cost of that delay. So I want to thank both of you for this critical conversation, and I look forward to hearing your perspectives, Doctor, as a medical professional, and Ray, of course, as an advocate. And Ray, you can take it from here.
Thank you so much, Senator Klobuchar. It is an honor to be sitting at the table, the virtual table, with you and having this discussion. I really want to begin with the critical importance of community and community engagement. We know that socioeconomic status deeply impacts healthcare outcomes. And as a community-based organization, we really aim to help people with sickle cell disease address the various barriers. We feel that we're well equipped to do this because we can meet people where they are. However, after 17 years of advocacy and nearly 7 years as a community-based organization, we see very little to no federal, state, or local support for smaller grassroots community-based organizations like ours. My question is, what can you do to increase funding support for community-based organizations that are striving to meet these needs so that there can be improved outcomes in the healthcare setting?
Very good. And, you know, so much of this is funding for research and the like. And what we do know is that sickle cell disproportionately, as we've already discussed, affects economically disadvantaged communities, making the private foundation support for sickle cell research harder to come by. And that means funding at the federal level, and that makes all the difference. And so what we know is that the HHS, that's the Federal Department of Health and Human Services, funds regional treatment collaboratives for the sickle cell community. And that program is not large enough, as I know Ray knows, to reach all the folks with sickle cell, and the doctor knows. So what happened? Well, Congress passed a bill in 2018, the Sickle Cell Treatment Act, that I supported, that increases resources for this program so we can ensure providers have the most up-to-date evidence-based information. The more healthcare workers we have that are trained, the more support these community-based organizations will get. And we're making sure that the bill gets fully funded so we can expand the treatment. And, you know, you can pass bills, but you also have to make sure the funding is there, and I'm committed to doing that.
That's exciting to hear because, yes, we can't hang our hat just on the fact that the bill is there, but it's the appropriations, it's the funding. So thank you for expressing your support. Now, when, you know, Dr. Lichtsinn, you've been in the sickle cell space for many years now. Can you speak to the access to care barriers that also face medical providers?
Yeah, absolutely. You know, many patients or many people with sickle cell don't have access to a sickle cell specialist at all in their community or even in their state. But even from within our sickle cell clinic at Hennepin, when I'm prescribing evidence-based treatments, at best, I have to jump through hoops from insurance companies, and at worst, insurance will flat out deny coverage for some of our treatments. And to be clear, there's, I think, only 5 medicines right now that are approved for sickle cell care. You know, and so sometimes even with insurance, these medicines are still unaffordable for my patients. So Senator Klobuchar, what are you doing, and what can you do to really help break down some of these barriers to treatment to allow better access?
Well, first of all, I support the Sickle Cell Disease Comprehensive Care Act, which is actually a new bill, and it would create a Medicaid pilot program to improve access to comprehensive high-quality outpatient care. And it is led by Senators Booker and Scott. It's bipartisan, and so I'm devoted to working with those two leads. It's always great to have a bipartisan bill in the U.S. Senate to get it done, and it could greatly improve the quality of and access to care for roughly half the SCD patients in the U.S. who are enrolled in Medicaid. So that's one of the main things I think that we have right before us right now, as well as getting the funding that I just described. That would be really, really important to basically put the money where our mouths are with the bill that was passed before.
I'm thrilled to hear that they're connecting the dots, right? All of this is interconnected and is so important in really being able to address it.
Actually, there's one other thing I just thought of, and that is making sure that prescription drugs are less expensive, and that's actually the Medicare negotiation thing will make a huge deal. I'm the lead on that bill, and President Biden brought it up at the State of the Union. I'm pretty excited about that, and we have some broad support. We almost had a deal on it this last year, and we're close to getting that done. That would make a difference. And the other thing is to make sure insurance companies can't prior authorize their way out of providing patients the treatment they need. I think the doctor knows what I'm talking about. Which is the insurance company says, well, before we're going to cover that treatment, the patient needs to prove X, Y, and Z. It's a lot of bureaucratic red tape, and that's something else we need to take care of.
Yeah, absolutely. No, and those prior authorizations are these huge barriers, and I appreciate that you're working to break them down. And I know sickle cell patients aren't the only ones who struggle with medication affordability. So.
And thank you for the work that you're doing on those bills and in supporting everything that's coming through Congress. As we mentioned earlier, we do have a glaring shortage of sickle cell experts providing care. If we could clone doctors like Dr. Lichtsinn, we absolutely would, and I wish we could. But organizations like American Society of Hematology, or ASH, they're working to increase the workforce through education. One of the foundational pillars of Sickle Cell Foundation of Minnesota is collaboration. And we really strive to partner with our local and national medical experts and institutions. So how could federally funded financial incentives or loan forgiveness, how could those be used to encourage more healthcare providers to care for people with sickle cell disease and other rare diseases?
Right, exactly. Well, I think, we have a major healthcare workforce crisis for everyone. And then that gets even harder for those rare diseases. And we, have to get more people into the field in general, and that especially will help rare diseases. And I've worked with my colleagues on legislation to grow the field with major investments in higher education, and also support for high school career technical education to make sure that students go into healthcare. And so that has got to be, and then I would also add the lifting the cap on immigration caps and visa caps and the like. We have a lot of, especially in our rural areas, we have a lot of doctors from other countries, as well as healthcare nurses and the like. And because of COVID and also the prior administration, there were some big limitations put on that. I actually have a bill to increase the number of healthcare workers in from other countries. So I think that would also be a major immediate help.
That's excellent. We so appreciate that. And in 2020, the National Academy of Science, Engineering, and Medicine, or NASEM, along with several sickle cell experts across the country, created a comprehensive report on the state of sickle cell care in the US. And there's a clear policy roadmap to improve quality of life and health care for people.
Excuse me, Ms. Ray, I hate to interrupt you, but our time is running out. Myself and the team will be available after the senator exits if you guys would like to continue a chat and ask additional questions. But thank you all for your time, and we apologize for the inconvenience.
No, Well, I can answer one more
Senator-
question. Okay.
Okay.
Hopefully you take that
We
over.
just want to know, what steps can you take to ensure this roadmap is recognized and followed among your colleagues?
Very good. So as I said, as co-chair of the Rare Disease Caucus with Senator Wicker, it really gives me some clout to work on that. And we are constantly looking for new ways to support the rare disease communities on a bipartisan basis. And in this case, we're going to, one, work hand in hand with Senator Booker and Tim Scott, Democrat, Republican, to make sure that, one, the Sickle Cell Treatment Act, which did pass, as I pointed out, is funded, and two, to work to pass their legislation, the Sickle Cell Disease Comprehensive Care Act, to get that done. And so those are the two sickle cell specific pieces of legislation. We have to get one is passed, funded, and then two passed. The final thing will be just the general things that would help everyone. More workers in the area, and we talked about solutions to that. Making sure that research for NIH is really strong, because a portion of that, of course, goes to sickle cell. Making sure that we're doing everything that we can to make it more affordable when people do have diseases, with bringing down the cost of prescription drugs and pushing on insurance coverage. So that's kind of my roadmap. I hope it's yours, because I'm really looking forward to working with you, Ray. And thank you, Doctor, for all your incredible work.
Thank you so much. We so appreciate it.
Thank you for taking the time to talk to us today.
Okay.
We really appreciate you.
All right. Thank you, guys.
Thank
See you.
you, Senator
Bye.
Klobuchar.
Okay. Bye.